Hi, this is Dr. Rogini. So today's topic is going to be on hip dysplasia. We have this little girl who's about 5 months old. She's getting an adjustment for her hip dysplasia. And when you have hip dysplasia, it's basically this socket where the hip joint is shallow. So in her case, it's not deep enough on both sides. But right now, it's much better since her last ultrasound. So today we're adjusting her. So your question is, why am I adjusting this little girl? The adjustment will help to improve the circulation to the hip joints. It will also improve the nerve supply and also maximize movement of every single joint in the spine and the pelvis. So when we check in today, we want to make sure everything is in alignment so she heals well, and it will also help her during the stages, during her milestones, like from sitting to crawling and then standing up and walking. So you want to address it sooner. The sooner you address, you can prevent a lot of other health issues later in life. So the good news in her case, so she hasn't dislocated, so her ligaments are strong enough. We want to maximize that. We also given the mother some massage tips, so what she can do at home to massage the muscles around, and she's doing that on a regular basis. So right now her hip joint has actually improved, so she's able to remove the harness off soon, like in a week or two.
Well, so we found out that Sadie had hip dysplasia when she was a month old, and she was in a Pavlik harness since she was 6 weeks. And after 2 months of being in there, we had a follow-up ultrasound, and there was almost no improvement from the first ultrasound to the second one after 8 weeks in the harness. So I was talking to a friend of mine who's a nutritionist, and she said, hey, you should take her to a chiropractor before you take her. She was referred to sick kids to possibly get surgery on her hips or have to be in a cast. Like, you know, it couldn't hurt to go to a chiropractor. So I was researching it, and I was like, do chiropractors even treat this? And anyway, so I called this chiropractor who's referred to me by my friend, Dr. Rogini, and she said, yeah, we can do it. I was like, okay, brought her along, and said, you know, can't hurt. We were just praying that she would be healed, and brought her here several times before her visit to sick kids for a follow-up ultrasound, and in 3 weeks, she went from having no improvement on the ultrasound to when I brought her in to sick kids, they said, why did they send you here? Her one hip is totally normal and the other hip is almost normal. So that was really drastic, you know, beyond what we expected. So we were really thankful. It's just an answer to prayer to find Dr. Rogini and to have this trend. She also couldn't look. She would always look to the one direction. But as soon as I brought her here, Dr. Rogini pointed it out, and then she's been kind of treating her for that.
Here you can see how her range of motion, her movement of her head has really drastically improved. She can actually go all the way far. The other side. There you go. Look at you. There you go. Look at you. All done.